there is no need for panic. What there is a need for consciousness, for conscious personal responsibility on the part of every citizen.
Our fight against COVID-19 continues in today's Jamaica Magazine. You've heard the call from Prime Minister Andrew Holness. Despite the influx of COVID-19 cases over the past few days, our safety depends on us. Let's worry less and work more to stop the spread of the virus. More COVID-19 reminders and encouragement await you right after this break.
Election Day is Thursday, September 3, and according to the Representation of the People Act, all employees are allowed 3 hours to vote on the day, excluding their normal lunch hour. But remember, this regulation does not apply to employees whose workday commences after 10 a.m. or who leave work before or at 2 p.m. Employees who volunteer to work on Election Day will be granted paid time off on the condition that they submit a written letter from the Electoral Office. Remember, voting is your right. So come September 3, exercise your right and vote safely.
Good day, I'm Stephen McHugh, and this is your JIS News for Friday, August 28. Government is moving quickly to increase the cadre of public health workers in the system to help manage the country's response to the COVID-19 pandemic. These include the recruitment of 120 medical officers, for which the Ministry of Finance had previously given approval. Health and Wellness Minister Dr. Christopher Tufton says deployment of these officers could begin within a week.
You would have recalled a discussion around those medical officers who did not have posts in the public health system. We have gotten the go-ahead to engage these persons, and I am told now that we will have contracts effective the 1st of September to engage these 121 medical officers.
The number of community health aides will also be increased from 750 to 1,000. And the regional health authorities are now assessing the number of additional public health inspectors to be engaged.
And the public health inspectors are very important to the process. They are at the local parish level. They go out in the field. They assess what is happening. And one of the primary reasons for engaging them is to provide leadership in terms of, the community health aides to assist with that.
In the meantime, the University Hospital of the West Indies is taking steps to increase its capacity to admit and care for COVID-19 patients. The UHWI, along with Princess Margaret, is one of 2 hospitals reported to have exhausted their COVID beds earlier this week. During the Health Ministry's digital press briefing Thursday night, CEO of the UHWI, Kevin Allen, said a mix of measures were being employed to make more beds available while addressing staffing concerns.
The situation as it is now will require us to expand. It may require expansion of our intensive care unit capacity, and it may require expansion of our ward capacity. At the present time, even though the ward is at capacity, what we plan to do is to move elective or non-COVID patients out to expand our COVID wards. As the number of cases increase, we know that we have to reinforce these teams, and we have that plan that's there to reinforce the team. And we, in some instances, will have to ask the other specialties to help with their patients.
Chief Medical Officer Dr. Jacqueline Bisesa-McKenzie pointed out that, given the rapidly increasing COVID-19 cases in the country, more hospitals could soon find themselves in the same position as the UHWI and Princess Margaret. As a result, she says the ministry's focus now has to be on how to shore up capacity right across the public health system.
The minister, the permanent secretary, and myself as the executive management and the rest of the team at the ministry are now looking at this new phase in terms of even more preparation, in terms of particularly focusing on our healthcare providers and how it is that we address some of these issues.
As at August 27, Jamaica has recorded a total of 1,870 positive COVID-19 cases. The bulk of the newest cases were registered in Kingston and St. Andrew, Clarendon and St. Catherine. There are currently 933 active cases being monitored, while 846 persons have recovered and been discharged from care. Director of Elections Glasspool Brown is assuring the public that the Electoral Commission of Jamaica, ECJ, is taking all necessary steps to protect voters and ensure a free and fair election come September 3. Mr. Brown was speaking during the Ministry of Health's digital press briefing Thursday. He reiterated that the ECJ was at an advanced stage of readiness with a mix of measures to ensure the safety of both electors and the electoral staff.
We have sought to recruit in excess of 7,400 persons, and we have put them into our team known as a sanitization team. Those 7,400 persons will spread across the 2,200 polling station location on election day. That team is geared towards ensuring that every person who enters our polling station location has on a mask. And also, that team will ensure that everybody who enters through that gate is sanitized and their temperature is taken.
The Director of Elections revealed that in addition to consultation with the Ministry of Health and in adherence to WHO COVID-19 protocols, the ECJ examined what was done in other countries which have hosted elections during the pandemic. He said the ECJ's resulting COVID-19 election protocol would operate on the presumption that every elector is positive, therefore driving measures designed to minimize the possibility of spread. In excess of 20,000 persons will be working with the ECJ to execute the August 31 Special Services election for Election Day workers, police and military personnel, and the September 3 general election. Health and Wellness Minister Dr. Christopher Tufton announced Thursday night that the National Health Fund would be providing all 139 duly nominated candidates with a small quantity of masks and sanitizer for distribution. He said this was to support public health mitigation measures. In other news, work is expected to resume on the $5.7 billion Western Children and Adolescents Hospital in St. James in short order. That's according to Director of the Western Regional Health Authority, Errol Green. He was speaking with JIS News recently. Due to the outbreak of COVID-19, work has halted on the 220-bed facility, which was being built on the grounds of the Cornwall Regional Hospital. But Mr. Green says efforts are now being made to recommence construction of the Children's Hospital, which is a gift from the People's Republic of China. He says a small team of Chinese engineers and workforce are already here and are awaiting the bulk of the group to come to Jamaica. Meanwhile, some of the materials and equipment needed for the construction are arriving in the island on schedule. Once completed, the hospital will be equipped with the necessary modern technology to treat illnesses and cater to the health needs of persons from birth to 18 years old. The Bank of Jamaica is projecting that near-term rate of inflation for the country will be in the range of 4 to 6%, which is within the BOJ's target. Governor Richard Biles gave the update during the central bank's digital quarterly press briefing on Wednesday. He said a 5 to 6% outturn was projected for the July to September 2020 quarter, 4 to 5% for the October to December 2020 period, and 5 to 6% for the January to March 2021 quarter. Mr. Biles says this near-term forecast is largely being influenced by a deceleration in agriculture and processed food price inflation, along with higher imported inflation, which is a general price increase resulting from heightened costs of imports. Over the next 2 years, the governor says inflation is projected to remain in the 4 to 6% band. And finally, the Cannabis Licensing Authority, CLA, has issued 67 ganja cultivation, retail, processing, research or transportation licenses to local companies and individuals since its establishment in 2015. The disclosure was made by Director of Research, Development and Communications at the CLA, Felisa Bailey, at a JIS think tank on Thursday. She said the licenses granted included 28 for cultivation, 23 for retail, 11 for processing, 4 for research and development, and 1 for transportation. For the 2020-2021 financial year, Ms. Bailey said the CLA had so far issued 7 licenses. There are also 21 applicants at the license-granted stage of the process.
And what this means is that upon the payment of the requisite license fees and security bonds, these licenses will be issued. Due to the impact of COVID-19, however, it is estimated that these payments should be made within the next couple of months.
The CLA's Director of Research, Development and Communications says the authority is working on several key projects to facilitate the growth and development of the industry. These include amendments of the interim regulations and the finalization and promulgation of regulations for the import, export, transit, and transshipment of cannabis. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.
Jamaica Social Investment Fund, JSIF, celebrating over 20 years of investment in community development. JSIF has forged relationships with international funding partners as well as private and public sector entities. Let us continue to invest to reduce vulnerabilities. Let us build our social capital and resilient infrastructures to ensure full participation in Vision 2030. JSIF, investing for community development.
Some persons turn to drugs to curtail their anxiety and calm their spirit in times of stress or uncertainty. If this is true for you, here's why and how you can curtail this dangerous habit.
Generally across the world, it is accepted that persons with substance use disorders and people who are chronic users, problematic users of various substances, particularly smoking. So you're smoking cigarettes, you're smoking ganja, you're vaping, and then also alcohol use puts you at a unique risk for developing the complications that are associated with COVID.
The novel coronavirus that causes COVID-19 is notorious for attacking the human lungs. It's no wonder then that among the most vulnerable are people with compromised lung function or lung disease as a result of chronic smoking and alcohol abuse. The National Council on Drug Abuse is now more than ever urging Jamaicans to reduce and avoid excessive smoking and alcohol use. Though persons may feel the need to resort to substance abuse during the COVID-19 outbreak due to stress, worry, and fear, this can be a detrimental move. Rather than relieving stress and worry, substance abuse will weaken the immune system, damage the liver and lungs, and put persons at greater risk for suffering the worst symptoms associated with COVID-19 and other life-threatening illnesses. Additionally, the behavioral practice of smoking also poses added risks. If a person's hands are contaminated, then putting a cigarette, spliff, or vaping device at their mouth will cause them to easily become infected with COVID-19. To reduce drug abuse among chronic users, the National Council on Drug Abuse has proposed a few coping mechanisms. Contact your relatives, friends, and ex-addicts if you are struggling with chronic drug abuse. They may not be able to physically be there with you, but a call can give you the encouragement you need. Having a healthy immune system is important to survive this and any other virus, so ensure you eat well and engage in regular exercise to boost your immune system. Some parents are experiencing additional stress by having to supervise their children at home during this time. Structure can make you more productive and lessen chaos. It can also be beneficial to ask your children to help create the schedule. Make time for alone time. Ask other family members in the home to supervise the children while you do something for yourself. Use the time to better yourself, create new habits, focus on what you need to learn, grow, and give. Spend time pinpointing the things that are making you stressed and prone to abusing drugs. Try to address them one step at a time and find ways to distract yourself when these triggers appear. The National Council on Drug Abuse is now offering telecounseling throughout the island. For the Eastern Office, persons can call 876-926-9002 or 876-469-2521 for the Central Office and 876-940-2240 for the Western Office. Persons can also contact the General Helpline at 876-564-HELP. That's 876-564-4357.
Government's stay-at-home order requires senior citizens and those with underlying health conditions to stay at home as much as possible. The good news is that senior citizens who are drug-serve patients aged 65 years and older can now request that their medications be delivered to their doorsteps. It's as simple as texting your name and a drug-serve pharmacy to the National Health Fund. If you or someone you know requires this NHF home delivery service, this next feature is one you should definitely watch.
Senior citizens in the cohort 60 years and older represent the fastest growing demographic segment of the society, as more people are living longer. This changing dynamic has prompted the government to ensure improvements in the level of responsiveness to new expectations and needs of our seniors. The need for quality healthcare is top of the list. One aspect of quality healthcare service is the prompt access to affordable medication. So the Ministry of Health and Wellness, through the National Health Fund NHF, has been leading the government's charge in providing critical supplies of medication at subsidized costs to persons in need. That includes seniors. The NHF has been improving its service by employing ingenious means of delivering medication and reducing waiting times and overcrowding at prescription outlets.
We are using a number of services in order to make it easier for our customers. We have the Prescript mobile app, we have a drop-off and pick-up service, we have scheduled refill for persons who come to the pharmacy frequently with the same medication, and we have a number of other initiatives in which we contact clients to work out easy ways for them to receive their medication.
A home delivery service for drug-served patients 65 years and older is the NHF's latest addition to its offerings. This emerged as a response to the coronavirus pandemic.
As most people know, the NHF is a customer-centric organization, and with COVID-19 we actually looked at different ways of better serving our customers. Medication delivery is an idea that we have had under active discussion for a number of years, and we found that this was an opportune time to implement this service.
This new service is available to drug-served patients on the NHF's scheduled refill program who have monthly appointments to pick up their medication at a drug-served pharmacy.
So for these patients, we give them 2 months supply of medications, basically, and the feedback is just excellent. It's really great. But when you look at how grateful they are, because some of them they can't walk, some of them they're disabled in terms of hearing and so on. So when you can come to them to actually give them their medications, it's really heart-touching, basically. So and they're very grateful. They say it all the time, and they are loving the service as it is now.
This was started in St. Thomas, and we've expanded into Kingston and St. Andrew, as well as in St. Catherine. And other parishes have now started, St. James and other parishes. And the intent is to have this program island-wide.
The NHF's home delivery service is set to benefit approximately 30,000 beneficiaries over 65 years of age, as well as other vulnerable groups that the fund believes can benefit from medication delivery.
We just received a call, asked if we would want it to be delivered, and we readily accepted it. The wait can be very long. I know they try to cut back sometimes by using the scheduled thing, but even then you have to go, and sometimes they wait up to an hour. So this is just ideal.
Patients may want to check out the NHF's online avenues such as web chat to indicate their need for delivery service. Persons can text their name and their drug-serve pharmacy to 876-219-9937. or 876-219-9929. They can also call the NHF at 876-906-1106 from 8 a.m. to 4 p.m. weekdays.
I take the opportunity to commend our pharmacists, our pharmacy technicians, and all the team who facilitated this.
This is a good service now. They say you must stay at home. And this service that you come and present, a wonderful service.
We are loving the service. We really appreciate it, and we wish it would continue.
Customers need not worry about having a National Health Fund NHF card or a Jamaica Drug for the Elderly JADEP card. The service will still be offered.
But at this time, when we come and realize that, oh, probably you don't have a card, what we can do is give you the steps as to how to get the cards. And in order to access the cards, it's a same-day printing at any of our drug serve locations that are named for that service.
The NHF, reaching out, helping to make Jamaica the place of choice to live in good health.
So by now we all know that the opening of schools, which was scheduled to begin on Monday, September 7, has been pushed back by a month to Monday, October 5. This is due to the rise in COVID-19 cases. If you're a grade 11 student who is still pondering your options for the new school year, watch this next feature on how government has expanded the sixth form program to increase accessibility and affordability.
I know our grade 11 students are wondering, where will we go come September in all of what is happening with the cost to cover tertiary institution. It may cause them to think that I'm not able to go to tertiary institution this year.
Stop right there. If this applies to you, meaning you're a grade 11 student who is wondering, will I be able to access tertiary education this academic year? Erase those doubts, because the Ministry of Education has some good news for you.
You are able to access your post-secondary education at your high school, and your high schools will partner with the tertiary institutions. The government will cover that cost, and our students will do this in pursuit of their associate degree or in preparation for their associate degrees.
It is no secret that COVID-19 has given rise to numerous economic constraints for parents and students worldwide. Some parents have lost their jobs, have experienced salary cuts, and as such, sending their youngsters to tertiary institutions this year seems like an unattainable feat. The Ministry of Education is well aware of these challenging circumstances, and as such, developed a plan.
This year, parents, we have rebranded our career advancement program to include the sixth form program. In the past, we would have accounted for at least 1/3 of our grade 11 cohorts moving on to sixth form, others into the world of work, others into community colleges. And the parents would have had to assume the cost for the community college program. Under this framework, all students would have an opportunity to enroll in one of our 3 pathways in sixth form, and this program will be covered under the resources of the government.
The new sixth form program will now take 3 forms, called Pathways 1, 2, and 3. They are designed to foster greater inclusion and accessibility for grade 11 students.
It's Pathway 1, which we call the traditional sixth form that you are accustomed to. Pathway 2, which we are now referring to as a technical sixth form, and Pathway 3, which is our general sixth form. So the traditional sixth form, those students who would matriculate with their 5 CSEC, including math and English, would have enrolled in their traditional sixth form at any institution. We will still retain that formula.
Under Pathway 1, students will be able to pursue subjects of their choice in a quest to obtain an associate degree in CAPE upon completion within 2 years. For Pathway 2, students will pursue Level 1 or 2 in a labor market skill of choice. They will be able to complete the program in 1 year and transition to the Occupational Associate Degree program in grade 13. To be enrolled, students should attain at least one CSEC subject, NVQJ, CVQ, or City and Guilds English and/or Mathematics Stage 3. Students who do not satisfy any of the above requirements will be required to sit the Heart Diagnostic Test and obtain a minimum mark of 25 in both mathematics and English. Pathway 3, on the other hand, is designed for students who do not meet any of the requirements established for traditional or technical pathways. The program developed will allow students to focus on strengthening their literacy and numeracy skills and working towards attaining City and Guilds certification. Students will also be introduced to a specialized skill area, in addition to their other developmental areas, leading to NVQJ certification. Those who make good progress will be able to transfer to the technical pathway. Pathways 2 and 3 will be executed in partnership with numerous public and private tertiary institutions across the island.
So some of our grade 11 students will pursue their sixth form program on tertiary campuses. So we have already started the consultations. We have met with our high school principals. We have met with our tertiary principals, and they will now continue the dialogue. We have developed the framework. We have put together the instrument that they will use for this partnership. And so the dialogue is continuing now as to how our students will be attached, who will be retained at the high school level, and who will pursue their sixth form program at a particular tertiary institution that is in close proximity to the high schools.
So you see, there is no need to be worried about your ability to fund tertiary education this academic year. The Ministry of Education has you covered.
So all students' parents, we are expecting all our grade 11 students to go back at the end of this exam period, when we will receive the exam results on the 27th of September of this year. We are expecting that our students will go back to their high school institution and they will indicate the area that they would want to pursue based on their subjects that they would have attained at the CSEC, in addition to the NCT VET, as well as any other program of study that they would have pursued, like the City and Guilds. So every student will have a place in our sixth form student for the new academic year.
To learn more about this new inclusive sixth form program, contact the Ministry of Education, Youth and Information at 922-140029. All the best.
During a recent virtual town hall meeting hosted by the Ministry of Education, Interim President of the National Parent-Teacher Association of Jamaica, Mitzi Harris Dillon, urged parents to work with teachers in the new school year in order to better meet the needs of students. To learn how you can become a more involved and cooperative parent who is helping to make Jamaica a better place for the younger generation to live, work, raise their families, and do business, take a look at this.
Let us work together with the ministry. Let us work together with our schools, ensuring that education continues. Let our voices be heard. If you are part of a PTA and it is not so active, or you need our help in ensuring that our PTAs become more involved, more active within the school environment, we ask that you contact us at our secretariat at the 876-612-5707 or email us at secretariat@nptaj@gmail.com and let us help you. It is now critical that as parents, we let our presence be felt. We must help our schools.
And this is the final stop in today's magazine. Thanks so much for journeying with us. As we go, we implore you to stay connected via our website, gis.gov.jm, or our YouTube channel. And while you're online, send your feedback to Jamaica Magazine at gis.gov.jm or via our social media pages. On behalf of the entire GIS production crew, I'm Audrey Williams, reminding you to stay safe and responsible in our fight against COVID-19.
This has been a production of the Jamaica Information Service, the voice of Jamaica.